I am a medical oncologist and I treat patients with hematological malignancies and solid tumors. I've been interested recently in some issues which are related to quality of life, and particularly to a new field which is called Oncofertility, which means taking care of patients and also considering their possible infertility due to cancer treatment. And we know that chemotherapy can induce sterility or infertility, both in males and females, and this is mainly due to the regimen, and alkylating agents are the most gonadotoxic agents that can impair fertility, to the duration of treatment, to the dosage of the drugs, and also to the age of the patients. And this is mostly true for females. Young patients have more ovarian reserve, which means that they have more eggs in their ovaries, and this makes the risk of becoming infertile less. But anyhow, 40 to 60% overall of our patients face the risk of becoming infertile after treatment. This is exactly one of the big problems. One of the big problems is the information and the education, because still now that we start talking about this issue, many patients are not informed by their physicians. Just to give you some figures, for example, 1 out of 3 patients with testicular cancer do not freeze their sperm. And this is really a pity, because freezing sperm is very easy. You just need to tell your patient that he can do that. And 2 out of 3 patients, female patients, do not receive any kind of information about the possibilities, the new possibilities of freezing either embryos or eggs or cortical part of their ovaries, the cortical part of their ovaries. And the two latter, so the freezing of the ovaries and freezing of the eggs, are still experimental procedures. But I think that patients should be informed about the possibility of having those procedures in centers that have protocols on this regard. It's a fast-moving field. There are new possibility of freezing. We can now freeze, for example, eggs with this very fast freezing protocols. It's called vitrification. And this ameliorates the rate of vitality, eggs vitality at thawing. So this is very important for fertilizing those eggs, for example. And there are other research on the best treatment to get the eggs. For example, in patients who have disease and have tumors which are endocrine responsive, you don't want to have very high levels of estrogens. And we can now combine different protocols to harvest a significant amount of eggs without increasing too much the levels of estrogens. Or we can just take a few slices of the ovaries, of the cortical part of the ovaries, and freeze those slices for subsequent thawing and use. And we can either reimplant those frozen ovaries or take from those strips the immature oocytes and mature those oocytes in vitro. So those are new possibilities. Again, they are still experimental, but I think that should be offered to patients, particularly when their need for further fertility or other pregnancies are on the table. We just presented a project at the European Institute of Oncology. What we want to do is to make things easy for our patients, so to offer them the possibility to freeze their sperms in the house, so inside the oncological institute, which of course is much easier. You don't have to organize all the things which sometimes can be quite difficult. And then to set up a network with the centers of fertility preservation and assisted reproduction to share protocols of mobilization and to freeze the eggs and the ovaries. She will be offered the possibility. We speak with her now about the possibility and refer her to the ART, the Assisted Reproductive Technology doctor, and we have already done that, but we will organize things better so that there will be easier for the patient, and she will not have the fuss to have to go from one place to the other.